Madam Deputy Speaker, thank you for granting us this opportunity to debate this supplementary estimate, which will be an opportunity for all members of this House to look at the PAC report on health and discuss how the money might be spent in different priorities. So I'm honoured to introduce this debate as Chair of the Public Accounts Committee, the first estimates debate on the supplementary estimate of the Department of Health and Social Care. I made this application jointly with the member for Oxford West and Abingdon, Chair of the Health and Social Care Select Committee, and my right honourable friend, the member for Salisbury and South Wiltshire. The Public Accounts Committee, as members of this House will know, is one of the oldest committees of this House and exists to protect taxpayers' money and ensure that their pound is being used effectively. I think it goes back to about 1867. Unlike other committees, we do not take evidence from government ministers, but we take evidence directly from permanent secretaries and the most senior civil servants and public sector officials. We use the National Audit Office to provide audited accounts and value for money reports, and we produce reports of our own with recommendations to government that they have to formally respond to as part of the Treasury Minute. At this point, Madam Deputy Speaker, I would like to pay tribute to Amanda Pritchard, who has just announced that she will be stepping down as the Chief Executive of NHS England this summer. She has overseen the NHS at a time when it has been under so much pressure post-pandemic, and I wish her well in her future endeavours. I'd also like to congratulate Chris Wormold on his promotion to Cabinet Secretary. However, these vacancies at the head of NHS England and the department provide an opportunity for completely fresh thinking within the NHS. Yes, of course I'll give way to the Chair.
Very briefly, I'm very grateful to him for giving way. May I echo the thanks to Amanda Pritchard for her time at the head of NHS England, and would I also welcome the appointment of Dr Penny Dash as the new Chair of NHS England. He is right to say that this is a really important moment in the future for the National Health Service.
Well, I thank the Chair of the Health and Social Care Committee for those endorsements on these very worthy work that these all individuals do put in the health service. So the Department of Health and Social Care is one of the highest spending departments in the UK, with a total departmental expenditure limit standing at a huge £210.1 billion. And I don't believe anybody believes that the NHS is working at optimal productivity. NHS England is the largest quango with the highest budget in Whitehall. However, when allocating funds, it is also one of the few departments that are making life and death decisions which affect the lives of literally millions of patients and their families. Therefore, I think it does deserve the highest level of scrutiny, which is part of what we're doing today. Before even getting onto the figures, the NAO confirmed that the level of productivity in the NHS has dropped by around 23% since the pandemic. And I simply say that unless this is sorted, any reform that the government announces will be sucked into the black hole of the NHS without getting commensurate value for money or results. I will give way. I don't want to give way to too many people, otherwise the Speaker will reprimand me for taking too long. But of course I'm happy to give way to the Honourable Lady.
Giving way. And on that point specifically, I was at my local hospital, County Hospital in Stafford, just a couple of weeks ago, and I noticed that they were still using paper to make notes, paper notes for patients. And actually, it's one of the biggest barriers into us being able to become more efficient in the NHS is our inability to have effective digital systems. Would he agree with me that the investment that's been announced into the NHS is long overdue in terms of moving ourselves from analogue to digital?
I entirely agree with the Honourable Lady. She's obviously been reading my speech, so if she, the announcement will come later in my speech, and then she'll know exactly what it says. Before even getting on to the figures, the NAO confirmed that the level, as I say, of productivity has dropped by 23%. So I welcome the government's commitment to a 10-year plan for the NHS. We've also repeatedly warned that an ageing and increasingly sick population, the NHS will struggle to cope with an ever-increasing multiple complex demands of our populations. So I'd like to split this speech into three sections about how productivity could be improved in the NHS, funding, and as the Honourable Lady alluded to, technical advancements and a shift into community care. The Department of Social Care's day-to-day spending, RDEL, is set to increase by £10.9 billion, from £187.9 billion to the main estimate as produced today of £198.5 billion. However, the worrying thing about the estimates today is that capital spending is set to decrease by around £1 billion, from £12.5 billion to £11.5 billion, a decrease of 8%. This is worrying, as it shows more and more funds are being redirected from long-term investment, for example in new hospitals, that the previous government had committed to. Yeah. And I welcome the Treasury guidelines that have stopped the practice of redirecting up to £1 billion in the last few years from capital to day-to-day spending, and that will mean that more money should be put into spending in that way. So the NHS estate, as we all know from our constituencies, is in desperate need of investment, and our capital investment programme is running behind schedule. The problems with RAC have only added to the necessity of upgrading our hospitals, and I hope the Minister will listen to this plea. In the latest NAO report on the DHSC, the DHSC annual report and accounts shows that local systems, i.e. ICB and NHS providers, reported a year-end overspend of £1.4 billion. This has nearly doubled from £621 million in 22-23. And this was despite an extra £4.5 billion of additional funding during 23-24, which was to support pay deals for non-medical staff, mitigate any impacts from industrial action, and money to address the costs of new pay arrangements for doctors and dentists. Whilst I do not think it's acceptable, the glacial pace in agreeing priorities and approving final budgets for the local systems. And in November, our committee was shocked to hear that in the last 2 years, those local systems, ICB and others, had not had their financial plans approved by the department until June and May, respectively. That is 3 to 2 months after the beginning of the year end. So how can our poor local systems plan efficiently when these final allocations and guidance are so late? However, if the department's main accounts were finalised much sooner, it would mean that our local systems would be able to have their money allocated in a more timely way, and therefore wastage and inefficient spending would be much less likely to occur. So I welcome the Secretary of State's prognosis that the NHS is far too big and complicated. There should be a shift towards allowing NHS trusts more control of their own budgets, as clarified in the 25-26 priorities and operational planning guidance that was published in January. I believe that by moving more funds directly to NHS trusts and ICBs and local systems will improve accountability and give them a level of flexibility about how their funds should be spent better, rather than just focusing on targets and directives. For example, if they were to run a surplus because they'd run their operations so well, rather than returning this money to Whitehall, they could reinvest it in capital projects that are desperately needed. And this also goes hand in hand with the need to improve productivity. So between 1996 and 2019, the NHS averaged a measly 0.6% year increase in productivity. Since the pandemic, the productivity has now fallen by 23%. And in March 24, the Conservative announcement that the NHS would receive £3.4 billion of capital investment for digital improvements between 25 and 26 and 27-8. This begins to start to address the point the Honourable Lady was mentioning. As part of this investment, NHS England is committed to achieving an ambitious average productivity improvements of 2% through the years 29 to 30. Just a second. However, those digital improvements that presaged by that additional £3.4 billion have not yet been fully actioned. I give way to the Honourable Gentleman.
Vincent give way, and I thank you for his speech and the scrutiny he's giving the NHS, which I think is really, really important. I wonder if he would agree with me that part of the issues we're talking about with productivity, and he reflected on the fact that that has been made worse, since the pandemic, is to do with the mental health of staff, and actually that's something that needs to be looked at. And supporting our NHS professionals to be as productive as they possibly can be includes looking after their health and their mental health as well.
That's exactly right. The NHS employs an enormous number of staff, over 1 million people, I think. And of course, their conditions of work are really important if we are to retain them. and that does mean that their mental health needs close attention where they have got problems. And if the NHS can't help with mental health, who can? So I think the honourable gentleman hit on a really important point, actually. One of the reasons that productivity is not improving more is that there are 19% more staff in the NHS, but they're only seeing 14% more patients. At our hearing, the NHS officials stated that this was due to more complex and acute health needs, meaning longer stays in hospital. But I also understand, to the honourable gentleman's point, that it was due to staff sicknesses, absences, and the ongoing then workforce industrial action that affected most patients last year, making targets more difficult to meet. And I'm still, I don't know about other honourable members, I'm still getting emails from constituents who have had their appointments and operations cancelled at the last minute due to that industrial action, and they're still waiting for their procedures to be rearranged. So along with staff, technology plays a big role in improving efficiency and productivity. And in 25/6, the Priorities and Operation Planning's guidance that the government stated that the NHS organisation will need to reduce their cost base by at least 1% and achieve 4% improvement in their productivity. Now, I understand that these figures are hard to pin down due to the NHS still negotiating with bodies like the ONS on precisely what the definition of productivity is and how it can be measured. So even if the numbers for productivity are disputed, we've still not seen, and I would say this to the Minister on the front bench today, we've still not seen a plan about how these productivity gains can be achieved, and the committees believe that NHS England have produced unrealistic estimates. So we really need to know what is the government's, the department's, realistic estimate of what productivity gains can be achieved over the next few years. Without significant productivity gains, the NHS will not substantially reform waiting times and achieve best value for money for the very large amount of money we spend on it. We spend, on average, around 4% increase in real terms each year, when the economy is only growing at 1%, which is completely unsustainable in the long run. If we go back to 2013, the Secretary of State for Health had set a challenge to the NHS to go paperless by 2018. Clearly, as we all know, this has not happened because the NHS is still using fax machines. In a digital age of AI, this lack of modernisation produces a risk to patients and a risk to employees in the NHS. Investing in better technology would help with the government's ambition to shift more care into the community. Community health care can take many forms, from GP surgeries, community hospitals, pharmacies, dentists, social care, and so much more. I fear that when we talk about the NHS budget, we predominantly focus on hospital care, rather than the care that most of our constituents need every day. And indeed, Lord Darcy, in his report that was commissioned by this government last year, said that the NHS budget is not being spent where it should be. Too great a share being spent in hospitals, too little in the community, and productivity is too low. And this is where I'd like to pay tribute to our GPs and all their staff across the country, especially in the North Cotswolds. Our GP surgeries are usually the first point of contact with our NHS. From antenatal services, blood tests, vaccination, and so much more, they offer a number of services that could be termed as preventative care. Now, we as a committee did question NHS officials on their prioritisation of preventing ill health rather than treating it, and avoid much more expensive hospital interventions in the future and a much better patient experience. And their reply was that they had little additional headroom to grow preventative services. Yet the public health grant used by local authorities to commission preventative measures such as health visitors and drug and alcohol services is expected to fall in value next year by 193 million, despite the government's commitment to maintaining it in real terms. I really can't stress enough, Madam Deputy Speaker, how I believe that we should be paying much more attention to prevention rather than cure. It is so important. NHS England said that rather than moving funds, there should be a focus on the role of GPs and how they can advise their patients. Although, according to the Royal Society of General Practitioners, more than 90% of patients' direct experience of the NHS is through primary care and GP practices, but currently less than 10% of that total budget is spent on primary care. I just do think, and I say to the Minister very gently, we're getting our priorities wrong here. So as a committee, we've recommended that the government should clearly define what counts as health prevention spending within the next 6 months and track that spending annually. ICB should also be given more flexibility as how they can spend their money, which might, for example, include redirecting to more community settings who are closer to patients. It might also include redirecting funds to help manage discharges from hospital. And according to the House of Commons Library, the latest data shows that an average of 12,340 patients per day last year remained in hospital despite being clinically fit to be discharged. And even though there is a slight decrease from last year of 1.2%, I do believe that more can be done to ensure patients who are well enough can leave hospital into the community and be closer to their families. This will require better working between social care and hospitals.
On that point,
I'm happy to give way.
I'm very grateful to the honourable member who's making a very powerful case for reforms and review. The Select Committee this morning, in fact, were looking at this very issue in respect of delayed discharge of medically fit patients. But does he not accept that, in fact, what we need is more integration? Because if only a quarter of those delayed discharges are down to a lack of social care package, many of those patients can't be discharged because they have a primary health care condition which needs to be taken care of, and that therefore it's actually integration and not just social care that needs to be reformed.
So, the honourable member makes an extremely powerful point. I'm coming to the conclusion of my speech, and it is on precisely that point. The social care system is not working in this country. It is a political football that keeps being passed from one government to the other. I understand the government has committed to another review of adult social care, where we won't expect results until at least 2028. For many of our elderly patients, this will be too late. The funding of social care is rising exponentially, and I believe there needs to be more focused and joined-up thinking from both DHSC, NHS England and local authorities on how they can support those that need the help to be discharged from hospital in a timely manner and live in their own home for a longer period than they might otherwise be able to. It should not be a postcode lottery that exists now. In conclusion, with more joined-up thinking between different parts of the NHS, I believe the patient experience could be better. However, without substantial increases in productivity, increase in spending on preventative care and public health, with a better functioning social care system, our NHS will never be able to operate at an optimum level at world-leading standards.